In a recent session of the COVID-19 inquiry, England's Chief Medical Officer, Professor Sir Chris Whitty, delivered a stark warning that echoes through the health community. Another pandemic, as devastating as COVID-19, is not just possible but inevitable. This declaration stems from the profound experiences of healthcare professionals during the COVID crisis, where the pressures on the National Health Service, that is NHS, reached catastrophic levels. Whitty emphasized the need to prepare for a future health crisis, highlighting that the UK's current intensive care capacity is alarmingly low compared to other high-income nations. He stated, "That's a choice, that's a political choice," underscoring that the limitations faced during the pandemic were not merely due to unforeseeable circumstances but were the result of deliberate decisions made over time. The capacity to respond effectively to health emergencies hinges on having trained personnel ready to act when needed. As he pointed out, it is impossible to rapidly train staff to the level of experienced ICU professionals within the short time frames that emergencies often demand. The lessons learned during COVID-19 must drive systemic changes to ensure that the UK is better prepared for future crises. The inquiry also saw emotional testimony from healthcare professionals who faced the harrowing realities of the pandemic. Dr. Kevin Fong recounted the overwhelming scenes in hospitals, where some staff were forced to store deceased patients in plastic refuse sacks due to a lack of body bags. He drew parallels between the psychological trauma experienced by NHS staff and the chaos of a terrorist attack, emphasizing the profound impact of the pandemic on healthcare workers' mental health. Whitty's testimony was a sobering reminder that the repercussions of the pandemic extended beyond direct health impacts like deaths and long COVID. There were also indirect effects on healthcare systems as a whole. He stressed that diseases other than COVID saw increased mortality rates due to the strain on healthcare resources, reiterating that the long-term consequences of the pandemic are far-reaching. The Chief Medical Officer also touched on the importance of addressing health inequalities, arguing that meaningful efforts must be made between pandemics to ensure that vulnerable populations receive the support they need. He advocated for a robust framework for rapid scientific research during health emergencies, highlighting that science, rather than political measures, is crucial for effectively managing pandemics. Whitty acknowledged that the government's initial response to the pandemic included messaging that might have been overly cautious. He expressed concerns about whether the public was adequately informed about the risks of COVID without instilling unnecessary fear. Balancing the need for caution with the public's mental well-being is a complex challenge that requires careful consideration in future responses. As the inquiry progresses, it becomes increasingly clear that the reflections from figures like Whitty are not just about understanding what went wrong during COVID-19 but also about how society can learn and adapt. The implications of his insights are profound. They call for systemic changes to bolster the NHS and ensure that when the next pandemic strikes, the nation is not caught unprepared. As we reflect on the past, we must remain vigilant and proactive, recognizing that the specter of future pandemics is a reality we cannot afford to ignore. Stay subscribed for more videos.